The conversation around transcranial magnetic stimulation has really fundamentally changed. If you're a provider already using TMS, you know it works. You know it's effective. The question now isn't if it works, but how you strategically use its value to shape the future of your practice in, well, a market that's changing so fast.
Right, we're moving past the validation stage. Our sources today, they all confirm that for a modern psychiatry practice, integrating something like TMS is no longer just an innovative option. It's quickly becoming a competitive necessity. We're here to talk about the trends, the operational side of things, and the value that goes way beyond just clinical outcomes.
And before we jump into all that, this discussion is brought to you by Sabres Medical at blossomtms.com. Their focus, just like ours, is really about empowering providers to lead this next era of care. It's about finding that sweet spot between, modernizing treatment and building a really strong, sustainable business. We're talking about that dual advantage.
Exactly. Our mission today is pretty straightforward. We need to elevate the conversation from what is TMS to how do we maximize its strategic impact.
Okay, let's unpack that, keeping our audience in mind. We've all seen the basic explanation of TMS, but for a seasoned provider who's maybe still using older protocols or just catching up on the literature, what's the latest insight on its precision and efficacy? What makes it so indispensable now?
Well, what's truly fascinating is the shift in focus. We're moving from just broad stimulation to specific connectivity mapping. It's beyond just hitting the DLPFC. The emphasis now is on identifying and disrupting those maladaptive neural circuits that actually drive the pathology. This offers a level of customization that systemic medications, by their very nature, they just can't achieve.
And that customization is so critical, not just for medication-resistant MDD cases, but for complex issues like treatment-resistant OCD or generalized anxiety. That ability to offer targeted disruption versus just a systemic adjustment, that's the core selling point for patients who haven't responded to anything else.
Absolutely. And the clinical literature is leaning hard into efficiency. Our sources are talking a lot about accelerated protocols, treating patients in shorter, more intensive bursts over maybe 2 to 3 weeks instead of the traditional 6-week model. This is key for boosting patient adherence, maximizing throughput, and it immediately elevates the quality of care you can offer compared to practices stuck on older, slower regimens.
So if I'm hearing this right, it's not just about offering an alternative. It's about providing superior, customized care that really adapts to patient needs and, honestly, modern scheduling realities.
Yeah.
It's about widening that clinical safety net.
Precisely. And if we connect this advanced clinical efficacy to the broader structure of a practice, the conversation very quickly shifts to strategic advantage. Our sources outline 5 major benefits, what we can call the 5-point advantage, which show why integrating this technology enhances outcomes, strengthens your reputation, and ultimately improves profitability.
Let's dive into those 5 points. Let's start with the first 2. Expanding treatment options and increasing patient retention. They seem very closely linked.
They are. They really are. Adding an FDA-cleared TMS system immediately captures a huge patient demographic. You have the people who are medication hesitant or the chronic non-responders. And critically, by offering both medication management and this kind of advanced interventional care, you create a high-trust, one-stop destination.
That continuity has to be invaluable. When patients can get all their escalating treatment under one roof, they're just far less likely to go somewhere else, which, protects your business pipeline and, more importantly, strengthens that long-term patient trust.
And that leads perfectly to point 3, strengthening clinical reputation. This is often dismissed as, just marketing, but how does the sheer presence of a modern TMS system really change how a practice is perceived?
It communicates a dedication to advanced science-backed protocols. Referring physicians notice that immediately. They're looking for partners who are staying current, especially with new research coming out, almost monthly? It's a visible investment. It signals true leadership in a pretty crowded field and attracts those high-value referrals.
That's where the market competitive edge truly sharpens.
Okay, let's tackle the big one, the real-world hurdle. Point 4, enhancing practice revenue. The sources say it's financially sustainable because insurance covers it. But for an established practice, what about the initial capital outlay? The equipment, the room build-out, staff training, that's a massive upfront hurdle.
That is the essential and the honest question. The sustainability model absolutely hinges on utilization and efficiency to overcome that initial investment. And while the equipment and training are significant costs, yes, the high reimbursement rates, plus the fact that major commercial payers and Medicare typically cover it for MDD, ensures a powerful return on investment.
So the key takeaway here is utilization. If a provider can accurately identify and treat that significant segment, the 30 to 40% of their existing patients that qualify, the utilization rate quickly offsets the cost. It transforms it into a self-sustaining revenue stream.
Precisely. It's a high-value, high-reimbursement service that, if you integrate it properly, generates consistent, measurable revenue. It can be a reliable buffer against the unpredictable nature of just standard consultation hours.
And finally, the ultimate payoff supporting long-term outcomes. This is the ethical and clinical reward.
Indeed. Unlike these cycles of continuous medication adjustments, TMS often leads to lasting symptom relief. When patients achieve that stability-maintaining improvements months or even years later, they become your greatest asset. Stable patients require fewer resources, they reduce no-show rates, and most powerfully, they provide incredible word-of-mouth reputation, testimonials.
The value proposition is undeniably strong, both clinically and financially. But for a provider looking to make this work, the operational side is where many get stalled. So we need to shift to the practical guide, the seamless integration roadmap. This is essential knowledge for remaining competitive.
Exactly. The process needs to be systematic and data-driven. Our sources break this down into 5 core steps for established clinics.
Step 1 seems mandatory. Evaluate clinical fit. This is where you leverage your existing data, right?
You start by doing a deep data dive on your current practice population. You have to ask, how many patients are on their 3rd or 4th antidepressant trial? What percentage meet the criteria for medication-resistant depression? Clinics often underestimate this demand. They miss that critical 30–40% of existing cases who are ideal TMS candidates right now. Quantifying that demand ensures high utilization from day one.
And once that internal demand is quantified, step 2 is choosing the right TMS system. This isn't just about buying a machine, is it? It's about acquiring technology that can adapt.
Absolutely. You need a system that offers proven precision, but also flexibility for future protocols, like support for advanced coil placement or newer forms of deep or accelerated TMS. And crucially, the system must be workflow friendly. It has to integrate seamlessly into your daily operations without causing significant friction. Reliability and speed of setup are just paramount.
Workflow and reliability. That leads right into step 3, train your team. We acknowledge the cost of training, but the quality of that training is the real long-term mitigator against liability and inefficiency.
High-quality, specialized training is essential. Your staff must be completely competent in magnet positioning, patient safety, and handling complex session setups. Comprehensive training ensures staff confidence, and that translates directly into consistent clinical outcomes. Consistency builds immediate trust.
Okay, moving to the patient side. Step 4, educate patients. How do we move beyond just general transparency to really engage them and ensure they stick with it?
It's about shifting the narrative. You have to move it from a last resort to a targeted, evidence-based solution. You must empower patients with specific, detailed data. Explain the localized nature of the treatment, detail the session logistics, discuss the success rates. Clear communication demystifies the technology, it reduces anxiety, and it maximizes adherence.
And the final, crucial step, step 5, track and optimize results. This is where clinical excellence meets accountability.
You have to establish rigorous, structured systems for monitoring progress. This means moving beyond just subjective feedback. You have to use standardized patient-reported outcome measures, or PROMs, and clinical assessments consistently. Robust analytics not only strengthen your clinical credibility for referring physicians, they provide the essential data you need to constantly refine and optimize your workflow. That's how you secure the strongest ROI.
This roadmap is really about positioning your practice for market leadership. Offering TMS today is fundamentally about meeting and even exceeding modern patient expectations for innovative, holistic, and effective care.
The takeaway here is that strategic integration elevates psychiatry. It future-proofs your approach. It ensures you're adaptable to complex patient needs and technologically advanced market demands. It moves you from reacting to leading.
So, as you consider integrating or expanding your TMS services, our sources call this the smartest long-term investment a practice can make. If that is true, if this technology is a foundational long-term commitment, what deeper ethical and financial commitments does this strategic investment imply for ensuring truly sustainable patient stability and driving that necessary operational growth year after year?
Food for thought indeed. For those ready to explore how Siebers Medical can help you strategically and efficiently integrate the Blossom TMS therapy system into your advanced practice, we encourage you to learn more.
You can reach Siebers Medical via email at sales@siebersmedical.com to discuss how they can help your practice lead this evolution in care. Thank you for joining us for this essential update on advancing modern mental health practice.